I'm sure every single one of us is grateful to the NHS over the last 70 years, or those years that we've been alive, for the care of ourselves, our parents, our children, friends and relations through birth, life and dying. The NHS is the most beautiful piece of collective work that has improved all our lives and means that no one should face serious illness alone or worrying about being unable to pay for the care that they need. It makes our country a truly civilised place to live, and we must all work to ensure that it can continue to play this absolutely crucial role in our lives. It's also important that we celebrate the remarkable contribution of people from other countries to making our NHS the absolute beacon of hope and good practice that it still is, despite the year-on-year squeezing of its budget. In the context of the Windrush scandal, we should particularly thank the African and Caribbean men and women who helped build the NHS and worked hard against all the odds and racism to maintain public services that we so gratefully enjoy today. And in addition, I'd also like to thank the 209,000 EU nationals that work in our health and social care sector. And lastly, with evidence that only a minority of our emergency service workers actually live in London due to the housing crisis, I was pleased to read, in response to a question submitted by my colleague, Assembly Member Berry, that the Mayor has confirmed he wants to build more homes that Londoners on low and middle incomes can afford to rent, possibly reserving a proportion of homes on NHS land for health service workers. This is particularly significant as we celebrate the 70th anniversary of the NHS. It's right that we show our gratitude in the way of this emotion like this, but as politicians and people who care about the NHS, we need to also work hard to bring about policies that truly support the lives of these NHS workers so they can continue to support the NHS for many years to come. I support the motion.